So for patients who don't have their entire breast removed, they have a surgery called lumpectomy, meaning that the rest of the breast is still preserved. In those cases, those patients need adjuvant radiation, and so those patients potentially could be a candidate for the AccuBoost. AccuBoost is a type of radiation that we call brachytherapy. Brachytherapy is a form of radiation in which we use a radioactive source, and we place the radioactive source very close to the organ that we want to treat, in this case the breast. And so we're treating the breast without having to shoot through the breast. The patient comes in, we have a mammography machine that's specially adapted with the AccuBoost. And so we place the patient's breast in the mammography machine, and through the mammography we can localize where the tumor used to be. Partly from that is that surgical clips are left by the surgeon, and we can identify those clips on the mammogram, and that's what we use to isolate where the tumor is. So for most women who have a partial mastectomy, this is followed up by external beam radiation, and then after that a boost is delivered to add a little extra dose to where the cancer used to be. Traditionally we used to give the boost using just external beam radiation, but in this case by using the AccuBoost, it's 5 treatments, and we use brachytherapy instead, and so this preserves the rest of the breast much better. And so they would still go through a short course of external beam radiation therapy, but the final week, the boost portion, is what's different about this. Traditional radiation, we actually shoot the radiation through the breast. The problem with that is oftentimes the exit dose can hit part of the lung, part of the chest wall, part of the heart, all organs that we don't want to hit. With the AccuBoost, we can localize the radiation much tighter so that it minimizes radiation to the parts of the body that we don't want radiation. We're the first institution in Nebraska to offer this type of treatment. This is great because I think this has a lot of advantages for women. One advantage is it would minimize toxicity to the organs. There was a large study that was published recently that showed that women who had breast cancer, who had radiation, 15, 20 years down the line, sometimes they get side effects in the heart because of it. With this type of treatment, we can help lower the risk of that occurring.